A total of 562 patients are battling severe nodding syndrome disease in Padey district. The health officer, Dr. Ben Oyo, has disclosed. These are part of 1,359 patients.
There is a disease the government has become silent about. That is nodding disease. Padey district is one of the districts which were highly affected with nodding disease. Currently, we have up to 1,359 patients of nodding disease, out of which 562 of them have severe form of nodding disease.
The households are heavily burdened and incapacitated by the adverse effects of the neurological disease believed to be transmitted by black fly vectors.
This jeopardizes their productivity at home. They cannot engage in productive work, and hence there is total poverty in those households affected.
Most patients have reportedly developed severe brain damage and require rehabilitation, as noted by Health Minister Dr. Ruth Jane Acheng.
We are very much aware that there were children who suffered from this syndrome long before we cleared the parasite from the flies. And these children need rehabilitation because some of them already have brain damage. Some are okay, they can go to school, they are slow. Some cannot meet the daily activities of life. Now those require rehabilitation.
Owing to the problem, some nodding syndrome disease patients, especially the male ones, have reportedly become perpetrators of sexual violence. Police, however, denied receiving a formal report.
Some of these patients, they get involved in incest-forced relationships where they can rape their own sisters, their mothers, and anybody they come against. And yet, these patients are always aggressive, and hence, it gives total responsibility to the parents and the siblings to take care of these patients.
But the District Health Department has called for urgent support from the government and the establishment of rehabilitation centers in the most affected areas, as promised by President Museveni.
Previously, the President had pledged that rehabilitation centers shall be put at Atanga Center 3 and Awere. Up to date, we haven't seen, and we request Ministry to build a rehabilitation center for nodding disease syndrome patients.
Dr. Acheng says the government has a limited resource envelope, but would consider rehabilitating the patients through the Ministry of Gender.
Some cannot meet the daily activities of life. Now those require rehabilitation. And that is a separate issue that government will work on through the Ministry of Gender. The Ministry of Health treats, but that rehabilitation requires the Ministry of Gender. And government is very much aware. As soon as resources are available, it will be handled.
Most families affected by the disease are living in abject poverty and are unable to fend for themselves. They accuse the government of turning a deaf ear to their plights.
My name is Naitia Jok. When I gave birth to him, he stayed for about 6 months. Then the problem of sickness started consistently. I have been struggling with him. I even took him to the hospital, but fruitlessly. Until now, he is still like that. I even took him to places whenever I hear they are registering people with disabilities, but I haven't received any support. My biggest request is, if he could be rehabilitated and supported to stand for himself, that would be good.
The disease burden is concentrated in Awere and Atanga sub-counties in Padey district, Odek and Gorafoe sub-counties in Omoro district, as well as parts of Kitgum and Gulu districts. Emmy Ojara, NTV, Padey district.